So with that, let me just say again that I really appreciate the work that you're doing. And even if you have moments like I had the other night where you think, I don't know if I'm doing any good, I don't know if this is worth it, I want you to remember that it really is. Back to talk about the pandemic a little bit, because we need to make sure we keep that in focus a little bit in our framework of what we do. Just remember that part of what's happening in the pandemic is we're all going through various stages of grief, and it's not a really pretty picture. Sometimes it's kind of chaotic and all over the place. And I really try to think about this when people are mean, like in public. You know, they're probably going through some grieving about the pandemic. Maybe that's why they're being such a jerk. Although jerk might not be the word I use, but that's what the word I use here. They might be going through some anger in those stages of grief. And so let me just let them have that. And then think about that for the things that we go through as well. So remember with the pandemic, it's all pretty uncommon. Even now, it's been months and months and months. We still don't know exactly what is going to happen. You know, we're experiencing a resurgence potentially, resurgence potentially. So we're a little unsure what that means. Thanksgiving, I think, looked different for a lot of people. Christmas is going to look different for a lot of people. Lots of uncertainty, particularly around finances and jobs and things like that. I've had 2 patients recently who've been laid off because of circumstances around the pandemic. Both of them were pretty surprised. So those types of things leave uncertainty for people. And in the context of what we're going to talk about today, I want you to remember that this is hard on all of us, on every single person. It is particularly hard, though, on people who have a history of dealing with mental health issues or substance use issues or trauma history, or co-occurring if they have multiple things. It's even tougher on people dealing with those issues. So just keep that kind of in your frame of reference as we go through. I always like to talk about one specific topic a little bit to the pandemic. Today I wanted to touch base on this pandemic scrambled living arrangements. And so during the pandemic, 38% of Americans have had to move or otherwise alter their living arrangements, particularly among men. Now, I don't know the details about why men, but I thought that was interesting. So 14% of people have had to move in with family or friends. Family or friends have had to move in with people. For 10% of people, 6% of people bought a new home. Now, I don't know how that compares to what percent of people usually buy a new home. 5% moved to a less expensive rental property. 3% moved to a different city within their state. 3% moved to a whole different state. There was some remodeling. 3% were temporarily homeless or in the process of being evicted or foreclosed. And 2% had to move to a different city or state, but do plan to return. So you can see there's been really significant changes in what's happening with living environment and living arrangements. And then certainly think about how that impacts homelessness, what that looks like, and how that impacts families. So those are just really crazy things that are happening because of the pandemic, right? Okay, so focusing on co-occurring disorders, that's what we're going to talk about today in the context of families and how it impacts families and how we can support families and why we should support families during this. I think it's just important to remember that when we talk about what co-occurring looks like, there is no particular look to it. It just kind of is. It is what it is. It can look like multiple things. When patients walk into our office, we don't kind of say, oh, this one's definitely co-occurring. That doesn't come out until we talk with them and kind of get their story before we know what's going on. And when we talk about those co-occurring, you know, there's so many similarities between the dynamics in families when there's mental health issues and when there's substance use issues. And since they're so connected, a lot of the family work is really, really similar when we're dealing with these issues. I was talking with a patient yesterday who has a history of stealing. She's stolen her parents' credit cards, and she's opened credit cards in family members' names. She stole a large amount of money from family members. This is kind of a behavior connected with some mental health issues. There's no substance use issue involved. There's little connection with maybe some pathological or problem gambling, but that's not big. It's really more connected to mental health. When I was talking to her yesterday about her family, I said, if you were had substance use disorder, I would be saying to your family, here's the boundaries to set. Don't give her money, and make sure you protect your money, and those types of things. And they're actually kind of the same. So a lot of times they look so similar, and what we do to try to support the families and the dynamics we see in families are the same, even though the issues might be different. So let's talk about what exactly is a family. And this, if we were doing this 10 years ago, certainly 20 years ago, 30 years ago, this part would be different. So I found these little funny jokes about the Serenity Prayer, which I think are so important around the holidays, because the Serenity Prayer, I think, is the best thing to focus on when you're trying to deal with family. But this one says, Lord, grant me the serenity to accept stupid people the way they are, the courage to maintain my self-control, and the wisdom to know that if I act on it, I will go to jail. So important things there. Grant me wine to accept the things I cannot change, coffee to change the things I can, and an opaque mug so my coworkers can't tell the difference. Some of you I know really relate to that. Grant me a vacation to make bearable what I can't change, a friend to make it funny, and the wisdom to never get my knickers in a knot because it solves nothing and it makes people look funny. And Lord, grant me the amnesia to forget the folks who bring me down, luck to bump into those who lift me up, and the vision to tell the difference. And then, of course, we go back to its purest form, that grant me the serenity to accept the things I cannot change. And there's a lot of things in family members that we cannot change. Courage to change the things I can. There are some things we can. And the wisdom to really know the difference. So that's just a way to kind of get us started. Talking about what's going on with families. And I see there were some nice comments to me, so thank you for those. So let's talk about what families look like. There we go. So, this is something that someone may say, yeah, that looks like my family. Maybe this looks like a family more like a single parent, possibly. Families of different ethnic backgrounds and things like that. We have different, maybe this is two moms, or maybe it's a mom and a sister raising a boy. It's hard to tell age-wise. We could look at this. Who knows what this family how this may identify as a family. Bigger families, extended family, tiny little families. I think a lot of people can relate to this right now. I really, if any of you are out there dealing with small kids in school, at home, and working, I absolutely send you good vibes. I don't know how you're doing that. I'm very glad that my kids are of an age where I can say, how's school? And they say they're taking care of it. And I know that they are. This is really, really tough. Looks really tough to me. Different kind of families. And I think it's important to recognize here, here's this doctor. We assume he's a doctor with his stethoscope. And sometimes a family extends beyond what is blood, extends beyond our parents and our siblings and our grandparents, and expands into other realms. And what made me think of this picture was when I went through treatments, when I had breast cancer, and when I went through radiation, you go every day for weeks. And, you're only there for like a half hour, but you have to go every day. And, I really started to feel like the people that worked there were part of my little family. They were people that I saw every day, people that I shared things with, people that I cared about. And so that can definitely happen. Families, I think this is just a reminder to us that when people come into our office, we can't just assume what their family looks like. That we have to let them tell us what their vision is of their family and what they call their family. I like those little babies. Look at them. Don't they look ornery? But that redheaded child in the middle, she looks really ornery. So this is just to make you laugh a little bit, and today's the perfect day for that, because why the Steelers are playing the Ravens at 3:40 in the afternoon is beyond me. And I'm certainly not going to be able to watch the game. I suspect many of you are not going to be able to watch the game. But here's a happy family, you know, all in their Steelers gear, and not so happy family in the Ravens. So I don't know if any of you out there are Ravens fans. If you are, well, sorry. And people sometimes ask me, because I grew up in Baltimore, but I live in Pittsburgh and have for more than half my life now. Lived here, but people sometimes say, you know, you're a Ravens fan, and I just remind them I have no allegiance to the Ravens. When I left Baltimore, actually, there were, you know, there was no football team in Baltimore, and the Ravens were actually still the Browns. So I have no allegiance to the Ravens at all. Plus, I live in Pittsburgh, and okay, so that's what families can kind of look like. There's some other ways to look at families, and these are helpful tools to use with people, to use different genograms. Any of you who've been to graduate school, you've probably had to do these if you studied social work or you studied counseling, because they're pretty common, and they're helpful, I think, to use with people. So what's interesting, though, I think, about genograms is, you know, this looks pretty easygoing. Here's another one which talks a little bit about not only the connection of the family members, but different mental health or physical issues that they may have, and how those things get passed along. So you see the paternal grandfather up in the right corner, a substance use disorder, and that was kind of passed on to the father, and then passed on to one of the children. Same with depression with the maternal grandfather. So we see some clues about what's happening in families when we see things that are in these types of environments, when we look at these things. Genograms can get pretty complicated, particularly now with the way families, you know, it's not like the 1950s where it was mom and dad and the kids. So families can be a little more chaotic. So if you look at this one, like, they're going way back up in the top left corner. They don't really know anything about the family there. They're not sure about who's who. Maybe Gertrude's a half sister. They're not sure. Up in the right corner, someone they know had a mysterious death. Maybe it was a suicide, maybe it was a murder, but they don't really know the details. And then even down to the very bottom with Josh and Ruth, they've been dating for 5 years. So they're considered they consider each other family, but they haven't married. And we see more of that too, as they say, less people are getting married. So here's what genograms and families therefore can look like. They can be really, really chaotic at times. And yeah, really chaotic, right? So we want to just remember that. And then this is what recently was called the queer model. And I think I disclosed this to you before. I am struggling with this word queer based on my history of how the word queer has been used. But in talking with younger people, and the word queer is becoming, they're turning it into a much more positive word to cover things that covers the whole LGBTQIA plus community. And they're taking it into a much more positive context. But for old heads like me, it's still difficult. But someone had put this genogram together, which they called the queer model, which talks about, you know, could there be a sperm donor or an egg donor? Is there natural gestation? Is there genetic blending, stem cell, IVF? There are all sorts of other things like that, which with technology really change what genograms can look like today too. And then, you know, when we look at what's happening with families, they're not just mom and dad get married and then they have some kids biologically. You know, we have people that are adopting. We have immigrants in our country legally and illegally. And there's all sorts of dynamics that are impacting families. And we need to be, when we look at it from a cultural perspective, we need to be very conscientious about that. And one of the things I've become conscious of recently with a patient that I was working with is, you know, in my family, to my knowledge anyway, we don't have anyone who is potentially illegally in the country. We don't even have anybody who is from a different country and here illegally. We're just all here. That's just the way we've been. But I was working with a family recently who was a little hesitant to talk to me about some family stuff, and it right over my head. This is how we have to continue to grow. Eventually it kind of came out that some of these family members, she's not sure if they're here in the country legally or not legally. And so her concern was to protect them. What if I was going to say, well, if they're here legally, I don't know who I'd call immigration, I guess, or something. And so we had to kind of talk through what that means as far as confidentiality and things like that, and build some trust and rapport. And then she, little by little, was a little more open to that. But I will say, when it was initially happening, I didn't know why she was being so difficult with me. It seemed difficult. It seemed like she was being difficult. And I was trying to figure out, what's the therapeutic reason of why this is happening. And, that never even crossed my mind. And so we just need to be more aware of things like that when we're dealing with families, that there may be some concerns that they have in different families that we may not think about, but we need to be aware of and sensitive to culturally. And my philosophy around that is, that when we do therapy, therapy is not political. We just do therapy because we work with people, and people are people, and that's what we do. And so, they're legal, they're illegal, I don't really care. I'm focused on their mental health, because the better mental health that people have, the better the world is going to be in our country and out of it. That's my philosophy. Different people may have a different philosophy, and I certainly would respect that. So that's some different ways to make sure that you're just thinking about what families look like. And so you can think about your own family, like what does your family look like? If you had to put it out in a genogram, would it be a nice, neat one, or would it be a little bit crazy? Funny story about family is my grandfather, my father's father. Let's see, my grandmother died when I was just born, and then my grandfather remarried. And so my step grandmother, I guess if you would call her that, I just call her my grandmother because she's been my grandmother as long as I can remember. We've always called her Alta. And it wasn't until I was about 12 or 13 that I realized that Alta was her name. I thought Alta was like we called my other grandmother Mama. I thought that was like a name that you call grandparents. And then I realized as I became into my early teen years that that's actually her name. Her name is Alta. And she just turned, just so you know, on the 29th, she just turned 91 years old. Pretty amazing, right? Okay, so now we've kind of just reframed and just focused a little bit on what families look like, and being really conscientious to remember that how people identify their family is important. It's kind of like that concept of recovery. We say that each individual gets to define their own recovery in the way that they want to define it for themselves. I think it's the same with family. Like we don't want to just assume that family is parents and siblings and grandparents and cousins and things like that. We want to really open that up to the client to see what do they see as their family. A lot of times when you're dealing with people with substance use disorder who get into recovery, they may have, the halfway houses, for example, we work with many men who had really lost connection with their biological families because of the disease. And now they're building a new family, which is sometimes connected to Narcotics Anonymous or their brothers. We always call them the Rudder brothers or the Moffat brothers. They were the, that family inside the house. And so sometimes that's the family that people have because of the consequences of some of the behaviors based on their disease. And so that's just something to just be really open and mindful of. So let's talk about how families work. So many of you have probably studied family systems theory, which is really important when dealing with families. And the basics of family systems theory is when one thing changes in the family, when one person is affected, everyone else is affected too. So the example I use in my own life is, you know, when I was diagnosed with breast cancer years ago, then, you know, obviously that affected me, but it also had a different effect on my kids, on my partner, you know, on my friends. So everyone in my little family system was impacted, although we weren't all impacted the same way. So we have to make sure that we look at families as like an organism that is continuously changing and reconstituting themselves. I think of this puzzle that the kids and I did when they were little. We're big puzzlers, or we have been in the past, not so much lately, which we should, but we had a puzzle once called a moving puzzle. And in this particular puzzle, it was an aquarium scene. And there were edges at the top. And so, but there were no edges on the side. So you put this puzzle together and you have this scene, and then you can literally take the pieces from this side of the puzzle and you can move them over to this side of the puzzle, and it changes the picture. And you can just keep doing that forever. It was really pretty amazing. But I always think that that's kind of like families, because we don't get to a point where we're like, okay, the puzzle is put together and now this is the way it is. The picture is clear, boom. It's not like that. We have moments of that, but then something changes. Something moves, and then everything starts to look different. So those are kind of the basics of family systems theory. If you're going to work with families, I would encourage you to make sure you do some more studies of this, because it is good core stuff to figuring out how to interact with families and what they're going through. So remember, as far as anyone knows, we're a nice, normal family. And I think sometimes when people come to therapy, this is what they're trying to portray, you know, is that, you know, we're normal. We're normal. But normal can look like a lot of different things. So I just think that's something to remember. So a couple different pieces when we look at family systems theory that we look at things. So first of all, there are often triangles in families. So when you're dealing with two people in a family, there's a lot of stability to that. You know, it's just me and you, and so there's less influence for difficulties, right? But at the same time, there's also less support if we do have difficulties, which is why sometimes triangles or threes sometimes are a little more stable than the two-person. Because if two people in a triangle are having a conflict, then the third person might be able to give some support, mediation, and just some relief from what's going on. And so that's why we see those. So when you look at families, like with kids, for example, you can look at the different triangulations within families with kids. You know, is it the kids and the mom, and dad's kind of out on his own? Is it mom and dad and one kid, and another kid is out on their own? You know where I see this the most is when this is going to be funny, but when I watch SUV, all the Law and Orders, because I'm a big Law and Order fan. Last night I watched an old episode of Law and Order Criminal Intent, and the father, or no, maybe it was SVU. I can't remember now. I get them all confused because I watched them all. But in one of the episodes, anyway, here's the point. The mother and her new boyfriend, and the boyfriend, who wasn't so new, but the boyfriend, had a daughter together. But the mother had an older son from a previous relationship. And the boyfriend was actually rather abusive with the son, but he wasn't like that with his daughter. So there was some triangulation there between the mother, the boyfriend, and the daughter, which had some strength to it. For the daughter, and particularly, it had some strength. And the three of them together could have some good times, but it did leave this odd person out, which was the son. So when you watch shows, sometimes you can see those types of things. Triangles are really the smallest, most stable of family relationships or relationship systems. And then sometimes triangles interlock. So you may have one triangle, and then if the tension gets too much there, then they pull another triangle in. And so you can kind of imagine, you know, there's a little exercise we do when we're in person that shows everybody kind of triangulating together and interlocking. We can't quite do that in this setting, but it's something hopefully you can kind of imagine it in your head. So more stable, the triangles usually are more stable than a dyad, but then there is often this odd man out. I was talking to my daughter about this recently, who is 17 now, and you know, she and some of her girlfriends just, you know, every once in a while, a couple of them go off in a direction, they leave somebody out. And I was saying to my daughter, that's just kind of what happens in those types of, you know, when you have groups, is that sometimes not everybody's on the same page and someone gets left out. And then that doesn't have to necessarily be bad, but it's good to know that it can happen. And then although there's more stability for tension, there's also more conflict because the person that's on the outside might be trying to change the way they're coming in, you know, the way their dynamic is in the group. And so that can create some additional conflict, so to speak. Okay, so let's talk about Amy and Michael here. Amy and Michael are pregnant, as you can see. So Amy and Michael, so think about dynamics of couples. Whatever the couple, you know, whether it's heterosexual or homosexual, just the pattern of couples, you know, is builds a foundation. And then when the baby comes, you like how I'm doing my graphics? That baby is coming slow. But when the baby comes, it changes the dynamics. You know, I've told this story before when I had my son, my first child, and I came home from the hospital. I was sitting in the living room and I was holding him and I started to cry. And my husband said, "It's okay, you're going to be a good mom." And I said, "I know, but you and that dog are on my last nerve." And it was in that moment that I realized that priorities really had changed. You know, that there was a life that I was responsible for that was really taking priority over everything else. And so we think about the triangulation. Now, the good thing about when this baby comes for Amy and Michael, it can give them a common goal. It can give them something that they both can focus on and can help them build even a stronger foundation and be stronger. It can also cause some conflict because let's just be stereotypical here. Maybe mom's paying too much attention to the baby, and or at least in dad's perception, and dad feels like he's not getting enough attention like he did in the relationship before. That can cause conflict. So these are kind of the building blocks of things that we see in families that we want to get used to, because we'll see them clearly in different relationships that we work with. So another concept of the family systems theory is about yeah. You see that there? Okay, I'm not even going to say it because I'm having trouble with my tongue for something this morning. But being able to differentiate ourselves from other people. So families and other social groups also think and feel and act a certain way. So individuals have some groupthink. You know, families tend to have a lot of the same values, but not all the same values. And some of that comes from just the pressure of being in the family. And some families push that more than other families. You know, I think in our family, you know, my kids have, you know, I always say that my kids are like little greeny weenies. Like they are so liberal that they make me, who I think is liberal, look conservative. You know, they're just like the next step. I'm okay with that because I want them to be, you know, I want them to figure that out and find out for themselves what is comfortable for them. And sometimes they teach me new things. Some families are not like that. Some families are like, this is my values and therefore this is going to be your values, and that's the way it has to be. So just learning where those types of things come. You know, some family members are more comfortable saying, my kid's different from me, and that's okay. In some families, if the kid is different from me, that's not a good thing. So recognizing those types of dynamics in families can be really helpful. And, you know, when we think about self, like the building of our own identity, you know, the stronger my identity is in myself, the more able I am to allow other people to have their own identities, right? But this is one of those things that happens for us in our younger years and builds, and sometimes it gets stunted. It gets stunted because of our own chemical use. It gets stunted because of our own mental health. It can get stunted because of the dynamics of our family, trauma, all sorts of things. So we can't just assume that it's because someone is a parent, for example, that they have been through this and resolved this kind of individuation process for themselves, and have a good solid, you know, this is who I am. We can't assume that that's the case, because those things don't always happen the way we would like them to. So people who have a poor sense of self depend a lot on looking for acceptance and approval of others. So you can look for that dynamic in families sometimes. Sometimes that's what leads people into having some difficulties with substances or with mental health issues, but particularly substances. Sometimes if people do not feel like they have a sense of self, good sense of self, and they're looking for acceptance and approval of others, if they can't find it in the family, they might be able to find it with some other substance users. And so we want to keep an eye on that kind of dynamic as well. People who do have a good sense of self usually can interact better with other people. They can make decisions and say, you know, I can agree to disagree kind of thing. They don't always have to push their opinion onto you, and they don't always have to adapt to your opinion either. They're more comfortable saying, well, I see it different and I'm okay with that. I'm not going to change my view, but I can respect yours as well. So it'd be great if everybody was like that, right? Then we'd have really healthy, fluid, sort of supportive families, but not everybody is like that. Everybody's on a different kind of path in that process. So if we go back to talk about Amy and Michael, then, you know, now that they've had the baby, I think, is it a little, yeah, there, there he comes again, there goes the baby again. Now that they've had their baby, that certainly can change the dynamics of a sense of self. Like in the story I told, you know, before I had William, my first child, you know, I had a set of priorities, and these were the priorities. And then once he came along, the priorities shifted. It changed who I was. You know, before he was born, I thought I knew what it was like to, you know, I had a vision of being a mother, but until I became a mother, I didn't really know how wonderful that can be and how painful that can be sometimes too. I saw a meme the other day that really cracked me up. It said, when you have a son, you're never really ready for him to go from calling you mommy to mom to bruh. I'm like, that is so true. I say to my boy all the time, like, I am not your bro, I'm not your bruh. Like, just, I'm your mother. But that made me laugh. But the point is that our sense of self, even if it's well established, when something happens and changes the dynamics in the family, like a baby, then that can change the sense of self. And sometimes that takes a while to adapt, and some people can do it quickly and some people don't. There are other things that can change that sense of self as well. It doesn't have to be just kids, but other things. So if a family member gets sick, and if a family member dies, if a family member is struggling with things like substance use or mental illness or co-occurring disorders, it can definitely change. You know, if my family member is struggling with something like that, it can change my sense of self, of who I am. So those are things to definitely remember. Jessica says sometimes she's the one that's saying bruh to them. I'm going to try that, see if that works, see if it gets the dishes done. Okay, so moving on, another concept we want to talk about is the nuclear family emotional process. And so one of the things, we looked at that graph earlier today that talked about people moving, because of the pandemic, people having to move in with family or friends and things like that. That's going to change with the dynamics of what's happening as well. And so just keep that in the back of your mind as we're going through these things. But so let's talk about marital conflict. As the tension in the family grows, each of the spouses, each of the partners in the marriage may end up putting their frustration and anxiety on the marriage when maybe that's not what it's about. So for example, if two parents are having difficulty with a child, they have differences. Here's a good example. I have a couple that I really, really enjoy working with, and they have a little boy. I think he's 6 or 7 now, but he's quite flamboyant. He is the life of the party. I mean, he's absolutely adorable. He also likes to paint his nails, and pink is his favorite color. And this makes his father crazy. And his father is a really, really likable, wonderful person. He's not some caricature that you might see, but he does not like, he doesn't want his son wearing nail polish. The mother is like, let him do it. If that's what he likes, what's the big deal? So the conflict is over the child and how to raise the child. But sometimes what happens is they end up putting that back on each other. And that can happen in relationships. And, that marriage, the partnership of the parents, for example, is a dyad. So it has some vulnerabilities there when you bring something else into it. So those are some dynamics to think about. Also, if there's some sort of dysfunction or difficulty with one spouse, the whole basis of family systems theory is if something happens to one person in the family, everyone else is affected. So if one spouse is having some sort of difficulties, substance use, mental health, trauma symptoms, then that dysfunction has an impact on the other partner. And that can change the way the other partner behaves. And then they can start to, become like a never-ending circle sometimes of what's going on there. So sometimes if there are difficulties with children, then spouses, I say spouses, but, again, heeding what I said earlier about what families look like, that the parents may not be spouses. But for sake of this, we will say they are. But if a child, if there's something, we see this dynamic a lot. If there is something wrong with if there's some sort of issue with one of the children, whether it's medical or mental health. So, for example, if we look at a kid in the family who has substance use, sometimes the other children will feel like that kid gets all the attention. It's not good attention necessarily, but that kid gets all the attention. And that is sometimes true. If a child, if you have a baby that comes home from the hospital and is sick, that child needs more attention. That means some of the other children may get less, but that can certainly create some dynamics there. And then sometimes people, when they're dealing with, in families, when they're dealing with difficulties, sometimes they start to isolate, pull away, detach. And that can create more anxiety in the relationship, and that can change things. So if you have two people that are used to being really communicative with each other, and because this person is dealing with some difficult stressors, maybe they pull away a little bit, then that's going to impact this person too. And so those are some of the dynamics we just need to keep an eye on. See what's going to happen. Oh, here comes the baby. So, the nuclear family, the family unit for Amy and Michael is changing. And then, wait for it. Wait for it. Maybe you have to wait a little longer than I thought. Ready? Oh, that second baby. All right, I make myself laugh. I know. You probably don't find it anywhere near as funny as I do. But so now think about our little couple here, Amy and Michael. Nice, strong relationship with the two of them together. They have their first baby. It kind of changes things. But they're working. They're keeping a good foundation. Most families do. And then most families keep it normal, right? And then now we bring a second baby into the mix. And that's going to change the dynamics even further. And so we want to keep an eye on those types of things. So there is this concept called the family projection process. And so this is the way that as parents, sometimes we transfer our issues onto our children. And I know this is one of the things that we hate as parents to do, but we do it naturally sometimes and without thinking. You know, I always say about my two kids, my two biological kids, that my son is exactly like me. And my daughter is everything I wish I could be. You know, so and that's the way I look at it, because my son is much more like me. My daughter has a lot of things that are mine as well. But she has a lot of things that she does better than I do. And my son does as well. But a lot of his things are just the same way. So what happens when I look at my son, for example, and this is a dynamic you see in families that you want to help people become aware of so that they can be mindful of it. Sometimes when I look at behaviors of that my son's going through at age, well, he'll be 20 this month. I think about behaviors, you know, it's suddenly like I'm 20 again, going through some of the things that he's going through. And then the focus gets on me in my head instead of focusing on him, because he's the one going through it for real. I'm just going back to a place where I was. And so this is a natural concept. You know, sometimes as parents, particularly when we see our kids struggle, we suddenly go back to when we had the same struggle, and we become the third grader or the 20-year-old or whatever. And so being aware of that is helpful for us. But when we do transfer some of our emotional issues onto our children, then it can make things much more difficult in parenting. Plus, we have a lot of guilt and things about that. You know, when I see my son and my daughter make mistakes that I made, there's a lot of guilt there. Like, how did I not teach them not to do that? You know, and I do have to remind myself sometimes that, you know, for me as an Aries, I am not always teachable. I learn best by doing things the hardest way possible, and then I'm like, oh, now I see what you were saying. That's just, I'm a little hard-headed, and my boy is exactly the same way. And so I have to sometimes remind myself that even if I do everything to try to teach him how to keep himself from making, you know, bad decisions or stupid decisions, he just may need to learn it the hard way. That's how I learned it. And but that's tough. That can create some guilt and some other things. And also it makes us want to feel responsible for things that happen to people in our family that we're not necessarily responsible for. So those are some dynamics just to keep an eye out for when you're looking at the interactions between families. So there's 3 steps to the projection process. The parent focuses on one particular child out of fear that something's wrong. The parent interprets the child's behavior as confirming the fear, and the parent treats the child as if something is really wrong. So here's an example of that. I have shared this before. When my son was 15, he was 16. He smoked weed with some friends. And the only way I found out was because he became really paranoid and his friends freaked out and called me and said, we don't know what to do with him. I became, you know, after I took care of the specific, you know, immediate issue, I became very overwhelmed and was like, that's it. My kid's going to be a heroin addict. I just know it. Like, In my mind, and with the work that I've done, not everyone who smokes weed becomes a heroin addict, but if you ask every heroin addict where they started, it most of the time included weed. So, my mind took off with a fear, and made something this big into something this big. And that made things worse for a little bit, because that was my own anxieties. And then because he had smoked weed and was kind of a jerk about it, it kind of confirmed what I was saying. Like, see this? I knew this was going to happen. And so we've kind of were able to work through that. But you can see that sometimes in families. And when you have things like addiction, or substance use disorder or mental health issues, there's a lot of that. If parents, if there's a couple, or if a family has some sort of mental illness somewhere in the background, Grandpa Joe was really depressed, then there is an anticipation that, oh, this child seems just like Grandpa Joe. I bet he's going to have that too. And it could put a lot of pressure on people. And so this is something that could happen in our little family here with Amy and Michael, is that they could, the first child comes along and everything's fine. Second child comes along and maybe has some difficulties, maybe medical, or maybe they're just not as well behaved as the first kid, who knows? But then that could change the dynamics with Michael and Amy. And one of the parents, let's just say Michael in this chance, could be like, I knew this one was this baby was gonna be a bad seed. We should have stopped at one. And those types of things he could project onto the child, and that can really change the dynamics in the family. And it can change the dynamics in the relationship of the parents as well, right? If one parent is negative about a child, the other parent may really take some offense to that. So there's lots of dynamics that can change. Then there's some multi-generational transmission process. So these are small things that happen over time that make a huge difference in families. And we see this, I think we're a little more sensitive to this now, because we're really looking at some cultural issues and the way they impact things. But if you look at things like domestic violence, a lot of times those things run in families. Sometimes they'll skip a generation, and there's good intentions sometimes, but sometimes those are multi-generational transmission process. I watched a movie over the weekend called, I think it's on Netflix. It was either on Netflix or Peacock, but regardless, it was called Hillbilly Effigy. And if you get a chance, watch it. It's a young man's story about growing up with his mother who has substance use disorder, and the grandparents are involved. But it's some really great visuals about multi-generational transmission process and how you can see things that happened. The main character as a boy doesn't realize it as a boy. All he sees is the things that his mother is going through. As he gets older, he learns that other people in the family before her went through this as well. And some of the things that the mother experienced because of that impacted what happened with her. So a really great movie. And plus it was a good movie. I will tell you, I cried like the entire time. So it's not like a fun movie, but I thought it was really good. And with the type of work we do, it's definitely worth watching. So if you think about Amy and Michael and their two little kids here who I did not name, you guys can think of names for them. But if you think about Amy and Michael, they both came to this relationship with a history. And so they may be passing some multi-generational family values, good and bad, on, and that they may pass down to their kids. So there's something to keep in the back of the mind as we look at how this works. The gentleman that I'm working with currently, that we're doing EMDR, we're working on trauma. He was a medic for many, many years. he's not anymore. But in learning more about his story, his brother was a medic. His father was a firefighter. His mother was a dispatcher. His great-grandfather was a firefighter. And there really is a multi-generational theme in this family that is connected to trauma through that type of work. You know, like, and the theme that the patient that I'm working with came up with is, if I can't save myself, at least I can save somebody else. And I really think that, you know, it's tougher for him because he has this long line of men in his family who have kind of had the same belief and did the same type of work. And so he's not a medic anymore because, well, for multiple reasons. Some of it is because he ran into issues with substance use disorder and he lost the job years ago. But also he realized that the trauma that he was experiencing was making him sicker in a lot of ways. And so he's moved on to do some other things. He's trying to break that cycle. But when you look back at his story, a long line of men saying to their boys, this is the way we do it, you know, this is the way we do it. And some of that's beautiful and some of it is not so healthy. Okay, so then some emotional cutoff. We see this a lot of times with families in different ways. People sometimes will cut people out of their lives as a way to try to deal with things. They may do that physically, like they might up and move, or say, you know, I'm not going to have you in my life anymore. Or they may do it in a little more subtle way by trying not to talk about certain issues. So that can be healthy or not so healthy. You know, I remember earlier this year talking to some families that I work with and couples who had a lot of political, like, family members that were at odds about who should win the election and da 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 da. And, you know, talking with them about how, you know, maybe at the family dinner, maybe that shouldn't be the topic of conversation. Not that you can't discuss it and not that you can't each have your own opinions and try to talk each other into changing your minds. That's fine. But maybe not do it at the Sunday dinner table if that's disruptive. And so just trying to use that in a healthier way to say, these are topics we're not going to talk about, at least not in these parameters, can be a really healthy thing. And so if we think about Amy and Michael in the context of their kids, you know, we haven't really discussed what their background was of their families, but let's just say that Michael's had some difficulty with his family over the years, and maybe he has moved away. Maybe he and Amy live someplace where they don't get to see his parents, and that might be a way to help him cope. And is a common thing that people sometimes do. So I wanted to talk real quick about sibling position because it can really have an impact. So take a look at these things and you can let me know over in the chat. I'm having a hard time getting again. Well, my problem is. But you can let me know over the chat, and at some point I will look at it. If you think this is true of you. So firstborn children tend to be natural leaders, high achievers, organized, on time, a little bossy, responsible, and they usually are rule followers. Middle children, a little more flexible, easygoing, peacemakers, pretty independent, can be a little secretive, may feel that life is unfair, you know, like a little Jan Brady, Marsha. They're good negotiators and often very generous. The last child is usually a little more of a risk taker, outgoing, creative, self-centered. Financially may have some difficulties, a little more competitive, gets bored easily, likes to be pampered, and usually a good sense of humor. And then if you have an only child, then they're usually close to the parents, have self-control. They have a lot of the features of the firstborn child, but maybe even to another level where they are much more dependable, but they can also be demanding, unforgiving, private, and very sensitive. So you can think about where you fall. Now, where this changes with how our families look. For example, I am the youngest of 2 children. So I fall in this category of the last child, and a lot of those things are true. I don't know if when I was younger, I was much more of a risk taker. Now I'm pretty lame. But I'd say I'm outgoing, creative. I can be self-centered. Financially, I'm pretty fiscal, actually, pretty frugal, actually, but I can be very competitive. And I like to think I'm funny. So I fit a lot of those characteristics of the last child. But in our family, my parents divorced when my brother and I were young. I think I was 8. I don't remember exactly, but I was younger than 10, and my brother would have been just a few years older than me. And when my parents split, it really did split the family in half. Like, I went and lived with my mother, and my brother went and lived with my father, and I didn't talk to my brother or my father for 10 plus years, and vice versa. My brother didn't talk with my mom. Sometimes over the years, my brother and I would talk because we went to the same school. We would see each other, but we weren't close. So in a lot of ways, I feel like I fell into that only child category as well. And so I meet the characteristics of some of those as well, based on just what was going on in the family. Even though I do have an older brother, I'd say, as far as only half my life that you're usually raised by your parents was with him, and the other half was not with him. So I want to see if I can get the chat, because I'd really like to see where you guys, if you guys see yourself in these categories. I just can't get it. I don't know. I'm going to take a look during the break. Okay, so just one more thing I think I want us to run through, and that's this societal emotional process. So here's what I want you to remember about all those things we just discussed about family systems theory, about triangles, about multi-generational processes, all those types of things. Not only do they apply to families, but they can also apply to other units that we belong to, like work, for example. So, you can think about, I know someone who always calls this guy that she works with her work husband, and he calls her his work wife. And they go a little too far with that sometimes, but I think it makes me a little uncomfortable. But the dynamics of the work environment can look like a family, and those same dynamics can happen. It can also happen in things like the justice system. It can also happen in things like programs that you're working in the halfway houses, in schools. So just remember that when we're thinking of this in the context of family, it can be much, much broader than that. So just keep. Okay. Yeah. Okay. Last couple things we're going to run through before we take a quick break. Some cultural issues. So when we talk about culture, all these things impact families. Advertising, media, social media, politics, religion, education, language, all these things, all these cultural issues have a huge impact on how families interact. So think about, I think the biggest one for people, my age, can think about is, when we were kids, when we were young, if we had a pandemic when I was young, a kid, I don't know what we would have done with ourselves, because we wouldn't have been able to do school virtually, and we wouldn't have had the technology to keep in touch with friends and things like that virtually like they do. It would have been very, very different. So that the technology has changed the way our families interact. And that's huge. You see pictures sometimes, or you go out to restaurants, when we used to go out to restaurants, and sometimes you see families and all the kids are on their phones while they're at dinner. That's a cultural thing, and that is definitely influencing how families are interacting. And And I would say the technology in particular is changing the way families are communicating with each other. And that could be kind of difficult. Now, the other day, I was just a funny story. I was talking to my son who is working and fiddles with the idea of going to school. He kind of goes back and forth. He's trying to figure out what the heck he wants to do with his life. But the other day, he was saying that with him working, he doesn't see how he could possibly go to school. Like, he just doesn't feel like there's enough hours in the day, and he was kind of overwhelmed with it. And I said, well, you know, when I was in school, that's all I had to say. When I was in school, and he said, I know, back when you were in school, there were only 6 hours in the day, and you did 8 million more things than I do. I get it. And then I think he called me a boomer. But it just made me laugh. I was like, yeah, it's true. There were only 6 hours. Now you kids today get 24 full hours in a day. We only had 6. But just remember that cultural issues can have a big influence on family, and they can help us define families in other ways too, like a religious family, or a family at work, or a family in a neighborhood, or things with you know, the Steelers family, those types of things. And so just keep that kind of in mind. And then just a little cartoon. This guy says, HR says we should be looking for a little fresh blood. Any idea what they're talking about? So here's a culture of everybody being exactly the same. In this case, and I swear this is not political, they're all old white men. And they're like, what, you know, HR says we should be looking for something different. Like, what's that mean? And that is a culture of some places. And then in this one, I like this guy with his cute little haircut is very clear. He says, you do as you're told, we pay as we please, you work like a slave, we punish at random. That, in a nutshell, is our corporate culture. So it would be nice if companies really did tell you what their actual corporate culture was, but usually we have to learn. Okay, I think at this point, we are going to take a break. So it's 10:21. Let's come back at 10:35, and then we're going to talk some more about some family stuff and how to, we're going to talk a little bit more about family dynamics, but then we're really going to start talking about how we help support families and teach them skills so that they can heal and be better. All right, so I'm going to stop sharing my screen. Okay, here goes the alarm. Okay, welcome back, everybody. Give me a second here. I got some advice. Let's see if I can make it work. Okay. I can't make it work. All right, give me 1 second, folks. Just talk amongst yourselves. Okay, here we go. So I was trying to make something happen because someone gave me some advice, but I still couldn't make it work. All right, hang on. I know you guys are probably so annoyed by me.
We'll have to have a lesson if we ever see each other in person again.
That would be nice. That would be nice. I thought I was doing so good. Okay, hang on 1 second. Hide video. Okay, I don't want to hide anything. Okay, we'll just do it like we do it. Okay, here we go. So welcome back. I looked through the chat while we were on break, and most people said that the sibling positions fit for them for the most part. A lot of people said also that they do, you know, we don't fit firmly in one, but we mostly fit in one and have some of the other traits. And then one of the ones I thought was most interesting was about sets of twins. So it's harder to tell when there's twins because the dynamics changed. I thought that was really interesting. But if you ever want something to study, you know, if you're up late at night with insomnia and you're like, what should I need something to occupy my brain. Study some sibling position. There's some really interesting, good stuff to it. So with that, let's talk a little bit more about family dynamics. You've probably all seen this. And this is one of the handouts that I think Jen will send to you too when she sends out certificates and things like that. This is helpful sometimes to use with families, to share it with them. They're usually in the session, when we do the session in person, we use these types of roles and do like a family sculpture, we call it, where people kind of act out the dynamics in the family. We often see this with people in where there's substance use involved or where there's mental health issues involved, but often there is a hero in the family who kind of takes care of things, high achiever, super responsible. Their MO is if I can just be better, then this problem in the family will go away. And then oftentimes the family hero is an oldest child. So that fits along with those sibling positions. Then there's a scapegoat, which was often we see as a kid who is acting out, who is a lot of anger, super sensitive, is hostile. And his kind of MO is, it's all going to be my fault anyway, so I might as well just do it. Mascot's in the middle here. He, is always making jokes. He's clowning around. His MO is, if I can just be funny or entertaining, then I can hopefully distract from what's happening in the family and get away from it. The chief enabler, a lot of times we look at that as the other partner in the family. If there's an alcoholic father, for example, then it's usually the partner who sometimes is the chief enabler. Sometimes it's a child, though, that can be the chief enabler. And the chief enabler is pretty fragile, self-blaming, very serious. And they really believe that the behaviors that they're doing are somehow helping the situation. That's their MO. They enable out of a place of love and kind of distorted. It's a little distorted, but they think it really is the most efficient way to help. And then we often see a lost child who's very withdrawn, quiet, passive. If you want to see a visual, description of this, you may be able to get a hold of an old video called Soft is the Heart of a Child, and it probably runs 20 to 30 minutes, and a really great description of dad who has substance use issues and mom who is a chief enabler. There are 3 children. There's a hero child who's probably 10. There is a mascot who's probably like 8, and then there's a lost child who's a little girl who's probably like 5 or 6. And just the whole description of how the family goes through this process of what's going on with them. You can see each of these roles really, really clearly. So this also talks, this can happen in families that have mental health issues as well. It can happen in any family, really. If you look around, if you think about your family, you can think about which of these roles you play the most. You probably don't, you may not fit into one of them, but you may fit into one more than the other. So, and there's different roles. The family hero, their role is to provide self-worth for the system. So they're the ones that, we can say, well, look at what Tommy did. Look how proud we are of him. And that kind of represents what we want the family to look like, even though it's Tommy's achievements, we can put it onto the family. The scapegoat provides distraction and focus to the system, and mascot provides fun. The chief enabler provides responsibility, and the lost child provides relief for the family by not taking up any time or attention. So those are some dynamics. In my experience, when I've worked with families that have substance use issues or mental health issues, I can often pick out several of these roles. I can't always pick them all out, and not every family has all the roles. And sometimes it's interesting because sometimes people play into they play more than one role. Like they might be the hero and the enabler at the same time. So it just gives us some context around what's going on with families. I'd like to say, ask me questions if you have any in the chat, and I'll answer them, but I can't always find my chat. Okay, so let's talk about why do we engage families. And let me just say that I think in our work, in our field, this is just the Jill Perry opinion, I think one of the areas we miss the boat most frequently is working with the families. Now, I understand why we miss that boat. I mean, there are so many barriers. There's confidentiality, for one, particularly when you're dealing in substance use. People sometimes won't allow their family to be involved in treatment. And so that's a restriction for us, that it just is what it is. We have restrictions around time. Back in the day, I remember we had a Gateway. They had 2 family therapists who traveled around to all the sites and worked with families. That's all they did. That was a whole job. Two whole jobs. And I think they may still have something like that there at Gateway, but many facilities have, just for budgetary reasons, have not been able to continue the dedication to those specific, not that the family work isn't getting done, but they've had to kind of fold it in to other people's responsibilities. And so then, when you only have so much time and energy, sometimes the family work gets put down to the side. But the reason I think that this is an area where we're really missing the boat is because, and I bet every one of you out there can say that you've experienced this. I've worked with many, many individuals in the halfway houses, for example, and then sent them home. Then they did fantastic in the structured environment of treatment. But when they got back to the world, the outside world, when they got back to their family, they reverted right back to some of the old behaviors because of the pressure of the family dynamics to do that. And so, sometimes families get sicker than the individual. The individual gets sick with the substance use or the mental health or the stuff that's working, the co-occurring stuff. Sometimes the family gets just as sick, sometimes even sicker. And so we just need to be aware of that. So there's a lot of reasons why we should engage the family. So number one is the benefit to recovery. So the stronger the we, and the stronger the we is, the stronger the recovery can be. And that's an important thing. It's important to include families because it can help to rebuild damaged relationships, particularly if the client is going to return home, or if the client does live at home, those types of things. Then there can be some damaged relationships that really need some healing. And the healing can't be done just by the one individual. It has to be done for the system, for the family. And so engaging families can really encourage them to heal. And we've seen this dynamic, I bet you have as well, where sometimes the family heals, and that healing of the family can impact the healing of the individual. So sometimes we have someone dealing with substance use issues, and they're very sick behavior-wise. The family's all enmeshed and crazy and da-da-da-da. And sometimes the family starts to heal and get better and change their behaviors and set boundaries. And then that can sometimes have an impact on the individual to change their behavior. It's not a guarantee. And I think that's important. We remind families of that, we want the family to get better, and hopefully that will pull your loved one back into the fold and help them get into recovery, but it might not. So those are some of the reasons why we want to engage family. A couple other reasons is sometimes family can be really, first of all, they know stuff, right? They have information, and they have examples, and they have specifics. So when we're trying to work with a client and trying to help them understand some of their behaviors, sometimes we don't have the right history to cut through that, and family members can. Sometimes it's the opposite. Sometimes patients can't hear things from their family members. I can't tell you how many times, like, a family member has said to me, my son came home and said that you said this, and I've said that 100 times, and he never heard me, but you said it is like the greatest thing ever. Like, well, You know, I'm just like that. But really, it's just the dynamic of the relationship of when people can hear things and who they can hear it from. And so that can work both ways. Sometimes they can't hear it from us, but they can hear it from a family member. And sometimes, like I said, that family member just has the information and we just don't have it. So when the client comes in and says, yep, I've been sober for a month, and then the family member says, you're full of crap, you have not. You know, this happened, this happened, this happened. And you're like, oh, okay. So that's a good reason to include family as well. Now, you always want to follow the requirements and the regulations and the protocols of your employer. But one of the things I always tell family members is, you know, confidentiality applies to me, sharing information with people. It does not apply to people sharing information with me. So, you know, I've often told family members, if you want to call me and tell me something, then by all means, you know, you can tell me whatever you want. You know, it does not mean I'm going to disclose back, and I'm not going to if I don't have the appropriate ability to do that. But I also do tell the family members, just remember, if you do call and tell me something, I am going to review it with the client. Like, this is not some secretive relationship where you can tell me stuff and then I just keep it in my head. Like, if you're going to tell me, then I'm going to share it with the client so that we can try to work through it. So be prepared for that. You know, sometimes families will call and say, well, I want to tell you something, but I don't want you to tell them I told you. Well, then you might want to think about it before you tell me. Because, you know, I have a relationship to protect with the patient, and that includes some trust, and that's an important thing. So that information that family has can be really helpful to get us to where we need to go to. And then also, a lot of times when we're dealing with co-occurring disorders, substance use, mental health issues, there are a lot of family secrets. And secrets, you know, like they say in the rooms, secrets keep us sick. And so the more we're able to bring the secrets out into the open and help people handle them and open those lines of communication, the better. And sometimes we need the whole family in order to do that. We can't do that necessarily with just one person. So some of the goals we have when we pull people and engage them into treatment, we just want to engage them. We want them to be a part of, and it doesn't matter if the motivation for the person coming to treatment is internal or external. It doesn't matter if the person woke up and was like, I need to do better, I want to go to treatment, or if the person's PO said, I don't care what you want, you're going to treatment. Either way, the family involvement can be helpful. So some of the goals we're looking at is to improve the interactions amongst the family members, which helps to improve our outcomes for everyone. If there are, you know, children involved, and this, you know, can be adult children or children, we want to help the parents work on their parenting skills and develop their confidence. So if they're dealing with a kid at home who's, you know, younger or in his teenage years, then that looks like one thing. But also, you know, we have kids living at home now till, you know, they're 40. I don't know about that. But we have kids living at home into their mid to late 20s now. That is not uncommon. And so parenting those kids looks very different. And so helping parents kind of figure out how to transition to that and what's appropriate and help build their confidence. And then, of course, one of the goals is we want to help healing for everyone. You know, when we have things like substance use disorder or depression, anxiety, post-traumatic stress disorder, remember that family systems theory. Everybody in the family is impacted, they're just impacted differently. And so everyone could use some healing. That's a good thing. Healing is a good thing. So in the old way that we used to approach family therapy was that we believed that there was something wrong in the family, and that's what caused the substance use disorder, or that's what caused the mental health disorder. So basically, it was the family's fault. That's kind of how we looked at it back in the day when we only had 6 hours in the day. That's how we looked at it. It was the family's fault. Then as we learned more and we became a little more enlightened, let's say, we really recognize that families have different risk factors and they have different protective factors. So they're not just good families or bad families. There are good parts of our families and there are not so good parts of our families. There are parts that make families that make substance use disorder, for example, riskier and that protect people from it. And so we started to look at things a little more in that approach. The way we try to look at it now is to remember that the family is multi-systemic, multi-dimensional, and that including the whole family in the process of therapy and of healing is the best for the whole person and the whole unit, let's say. So when we look at it this way, the family becomes the patient. So it's not, Bob, who is sober 3 days, is the patient, and then there's his family. The patient itself actually becomes, the family itself actually becomes the patient. Now this creates some interesting things when it comes to like insurance companies and paperwork, excuse me, and those types of things. So again, you always want to follow the policy of your organization. But, for example, here in private practice, sometimes we do work with families. We don't bill necessarily for family work. Some insurance companies don't even have a code that they allow for that or coverage for that. So we might bill, and so therefore the record is in the name of patient X. But philosophically, when we look at the approach, the family is the patient. For example, the family that I talked to you about earlier, whose son recently completed a suicide, the family really was the patient. The dad was the first one to come see me, but it was clear from what he and I discussed right off the bat that what we wanted to look at was the dynamics of the family, and we were going to include different people in the family at different times. And so the family is the patient, even though the chart is in dad's name. So that's just something to consider. So think about that. We definitely don't want to go back to the old school way and say, well, look, it's the family's fault that these things have happened. Although some of your patients may come to you and say that, my mother had depression and now I have depression, so that's her fault. Your patients may say that, but we don't want to look at it that way. We want to look at it in risk factors and protective factors, and we want to look at it as best we can as the family as a whole being the patient, and with a whole bunch of different parts, right? So I have this quick video. Jen, you're just going to let me know if you can't hear the audio. If I don't hear anything from you, Jen, I'll think it's working correctly.
No audio.
I love you, Dad.
Dang it.
Wait.
All right, hang on, let's see. No audio, you said?
No, I think people were hearing it.
Was it good? Was it better earlier and it's starting to get muffled now?
No, it was muffled in the beginning, but it's bad.
This will have to be part of our technical lesson, Jen. So a couple things about that. Some of you may have seen that if you saw the movies. But first of all, I love that Carrie Fisher is the therapist. I just think, when as open as she was about her mental health issues, that was just a really nice, I just really like that she's the therapist there. But I do laugh at the beginning part, if you didn't catch it because of the sound. He said, first of all, Dr. Evil there said that he had been frozen all his life. And then Carrie Fisher was like, did you hear that? Like, how incredible for you to admit that you've been frozen all your life. Like, I do think as therapists, sometimes we think like that. But really just a farcical thing about how it is with families. Now this end part here that's starting to get really muffled, Dr. Evil is really kind of going off about his childhood, and which is kind of crazy. And that happens sometimes when you're working with families. kind of like some of the things we talked about when you work with groups and you have patients that are narcissistic, or you have patients that take over, then you can have that happen with families too, and that can help you kind of determine a little bit of the dynamics of what's going on. Nope. Okay. So we did a whole session at one point on stages of change. So we're not going to talk about that too much here, but I did want to just remind everybody that it's something good to look at when you're dealing with families, to remember the stages of change, and you remember when we talked about working with clients with co-occurring disorders, we said that one of the things that's important to do is to look at what stage of change they're in for each issue. So they may be in pre-contemplation for their substance use, but in preparation for their depression, for example, or, and they may be going back and forth. So to really see what stage they're in, the individual's in, for each of the issues that they're dealing with. Well, now let's just make it more complicated, right? That's an important thing to do for each of the family members. So you may have a family that comes to work with you, and they're in all different stages of change when it comes to the issue that they're coming to you for. And they're not coming to you for just one issue, right? So now you really have to break down for each member of the family what stage of change they're in for each different issue or goal that you're working on. And that can be tough, but it can also be really, really helpful. And actually, to help explain the stages of change to families and have them identify where they are or where they see each other at can be really helpful for them, because someone who's in pre-contemplation, for example, may look very disruptive or disrespectful to another family member who's further along in the stages of change. Now, if they recognize and if they can learn a little bit about why they're in that place, then it might change the dynamics some for them. So the stages of change is a good foundation when you're dealing with families. It's a good foundation to educate the families about it, so they can, because remember, with stages of change, with all the research they've done, can be used for any issue. And so, to educate people about what it is and help them figure out on their own where they think they are at different times and when they're moving back and forth and things like that can be really helpful. And sometimes if you have a family who, let's say you have 5 people in a family. Let's say you have a dad and a stepmom and 3 kids, and they're coming in because they are having lots of conflict in the family. And, maybe your first session or your first several sessions, it's hard to even get everybody on the same page. This can be an exercise or a topic that you can help get everybody on the same page. They might be in different stages and things like that, but you can teach them the concepts, and that can build strength in them to be able to have a common goal, that they're at least learning something and looking at something on the same page. So there are a number of barriers to working with families and to having success with families, and that's one of the things I wanted to make sure we talk about today. So one is an inability or an unwillingness to adapt effectively to the situation at hand or collaborate with one another to seek help. So basically what that means is sometimes you have families that some of them are willing to make some changes and some of them are not willing to make changes. And the ones that are not willing to make changes kind of end up holding some of the power. And that can make things difficult. The key to eliminating barriers with counseling, you can find the key inside the family's interactions. So if you can teach them to overcome some of the dynamics in the family, then you can usually get them to work better in the therapeutic process. That can take lots of time in and of itself. And remember, it's like that moving puzzle we talked about at the beginning. So you may get a family in, and then you're finally getting them to be agreeable to work with each other and focus on, and then something might change. So, this puzzle piece may move over here, and now it's different. So it can be very complicated. So when you're dealing with barriers and working with families, one thing you want to do is see if you can identify what the barrier is. Sometimes the barrier is very concrete. We have young children and they're not appropriate for therapy, and we don't have any place to take them while we're doing a session. We don't have transportation. We don't have a virtual scenario. We don't have a computer at home or a smartphone or anything that we can do a virtual session with. So there can be all sorts of barriers that might be, you know, insurance, finances. those come up quite a lot. You know, one of the things we're preparing for now is, and any of you that are maybe in private practice are as well, is UPMC and Highmark have paid the majority of, well, UPMC has paid all of, Highmark has paid the majority of their co-pays for their clients during the pandemic for virtual sessions. And that has been a huge, that lifted a huge financial barrier for a number of people who maybe had large deductible or large co-pays, like $60 a session, things like that. And that's coming to an end, the end of this month. It's been extended a couple times. I suppose it could be extended again, although they haven't, no one said anything yet. Usually we've kind of heard by now. So thinking, we're trying to prepare patients now that, you know, this is going to come back. Your financial responsibility with your copay is going to come back. If that's a problem, let's figure out now how we can deal with it and still get you the care you need. So sometimes you can identify a very specific barrier, and then you can help them come up with resources, because people don't always know what the resources are. Sometimes we're the keeper of those things, and we can get those things out to them, those resources out to people, so they can we can get rid of the barrier. So the question to ask ourselves, and even ask the family, is what has happened that will not allow this family to do what may be best for them? So if we're seeing dynamics that are repeating themselves in the family and we're not sure why they're not able to move past that, you know, we're on the outside looking in saying, clearly this is what you should do, clearly this is an issue, but they're not able to see that, or they're not able to make changes. You know, that's the question. What has happened that's causing this? You know, people want to do better for other people, right? Particularly people that we care about the most, like family. So if people are not willing or able to do what's best for the family and for each other and the people they love, what's keeping them from doing that? And it can be, you know, that can be really, really key. And sometimes asking the family to ponder on that can open some things up a little bit. And not that they're going to say, oh, here's the answer, but it can get them thinking, and then you can help them broaden that. So if you think about it, the very same things we do for individuals when we're trying to deal with barriers, we do the same things with family. We look at the stages of change. We look at their history and what benefit they're getting out of the dynamics that they're using. And we teach them new skills. We ask them, you know, the magic question: what would happen if you did this? You know, what would happen? What would your life look like if this problem didn't exist anymore? You know, we ask them those types of questions, open-ended questions, to really get them thinking and hopefully make some changes. So there's a couple different types of patients we deal with in families that can hinder the family therapeutic process. So this guy, Dan the Man, he's called the powerful persona. And when we're dealing with the powerful persona, you still see my screen here? Okay, now I got it. Sorry, you know how I have difficulties. Okay, so when we're dealing, so here's Dan the Man, he's our powerful persona. So you'll see this often in roles in families where a family comes in and one person kind of takes over. You notice that he answers the important questions. People look to him before they answer questions themselves. Maybe he corrects people if they answer a question in a way that he doesn't want them to. And so those are some interesting dynamics. I think I shared with you recently, I was working with a family, and the husband, it was the first time I'd met with the husband in the context of the family, and he was perfectly appropriate throughout the whole session. But then at the very, very end, he, Jen made me laugh. She said that Dan the man is her mother. I should have named her after her, huh? But at the end of the session, the wife, who's pretty quiet and timid, she answered a question, and he was sitting right next to her. They were right next to each other on the sofa, and he turned to her and he said, "That is not how it is. I told you this is how it is." And his whole demeanor, he became Dan the man in that moment. He was, whatever he said was the way it was going to go. And it was actually very uncomfortable for me. That dynamic was, I kind of wanted to punch him, which I did not do, of course, because that would never be therapeutic. But what I did do was kind of call to his attention that, asked him to think about why that came out then and when it hadn't come out the whole session. And then we were able to do some good work in following sessions around that. But being able to identify who your Dan the man is, if there is one, can be really helpful. And remember that when you have a powerful persona like this in a family, they have a story, first of all. So there's a reason why this is their persona, why this is their characteristics. And there are probably reasons why they don't want that to change. So they have a huge investment to protect that persona, to keep the power in the family. It may be to protect them from people learning secrets. It may be just to keep control, which it maybe helps alleviate their anxiety. It could be any number of things, but to figure out what that is can be helpful, and to recognize the impact that it has on the rest of the family can be helpful. So in addition to Dan the man, we also have our structure protector, which I named Karen. No offense to any Karens out there, or any women named Karen. So our structure protector. So this is kind of like our enabler a little bit. She's really good at keeping structure and keeping things functioning, but she's also very good at keeping things status quo. So she doesn't necessarily make sure things function in the healthiest way. She just makes sure that they continue to function the way that they do. So you could imagine if you have Dan the man, who is the powerful person in the family. He makes the decisions. He decides who says what and when. And then you have a structure protector like Karen. She's going to protect that dynamic for him. So they kind of work hand in hand. What I find interesting about the structure protector when you're dealing with families is sometimes they just have no idea. They're kind of like on automatic pilot, and they're very good at what they do. They're very smart, and they're good leaders. They're just not always able to recognize if they're leading in a good way or not leading in a good way. And again, so a Karen has a history, right? That made this position comfortable for her, and she has reasons to protect it. Probably most importantly is she knows what to expect when this is, when the structure is protected and everything goes as normal, then she knows exactly what to expect, and that can alleviate anxiety for her. If things are different, then things will be different, and that can be that can cause some anxiety. So this is a way to kind of protect expectations. We also sometimes have a disengaged parent. I called this person Rip. And if any of you watched Yellowstone, I don't know, it just made me think of him. So if you have a disengaged parent, for example, you can also have other disengaged people in the family. But in this context for a second, let's just talk about a parent who is disengaged. That can really wreak havoc on the family, right? Because people don't always know how to interpret that. It can be very passive aggressive. Even though they may be disengaging from the family, they may also be very powerful in their disengagement and those types of things. So this is definitely a type of family member that you want to look at and see, is their engagement important? And, you know, what is their story? Why are they so disengaged? Is it that they just don't see a place for themselves, or is it a powerful move? And that's something to take a look at. And so what is their story and what is their benefit from not engaging? Now, sometimes you find your disengaged parent or your disengaged person in the family is the person with substance use or with mental health issues. And the part of their disengagement may be shame and guilt and secrets. So trying to figure out what their story is and what their benefit is can help you try to figure out how to include them back into the family. Now let's talk about secrets. You know, secrets keep us sick. So sometimes people who know about the secrets will be resistant to work in family therapy because they're afraid that the secret's going to come out and they're going to be the scapegoat. Or they're afraid that the secret might be really dangerous. And maybe it is dangerous, or maybe it is perceived dangerous. So sometimes, you know, if there's domestic violence in a household, for example, that's a family that's probably going to be really anxious about going into family therapy. Because if the secret comes out that there is domestic violence, first of all, there's a real threat that that domestic violence might increase. And so that there's some real danger there that people perceive. There's also sometimes secrets may not seem so dangerous or may not seem dangerous to us, but they seem dangerous to the person. You know, a good example of that I think would be a young woman I was working with recently. She's in her late 20s now, but she came out to her family as bisexual when she was about 20. And she knew she was bisexual since forever, basically. But her perception was that when her family, if she came out to her family about this when she was younger, her perception was it was just going to be terrible. And, you know, talking with her about what does that mean? What does terrible mean? You know, really trying to pull it out. She was able to eventually be able to come forward. And once she shared the secret, it wasn't what she thought it was going to be. Her family actually really embraced her and still loved her and said, hey, you know, we love you, not who you are, or what you do, or who you love. So, but that secret had a perceived sense of danger to her that she had to work through. So we have to remember that sometimes that's one of the difficulties with secrets, is that families are afraid that those secrets are going to come out. And then I was thinking of another story about secrets. There's so many. I mean, if you think of any really good TV show or movie or book that you've been engaged in, there's always secrets, right? There's always secrets. So there's lots of them in the world. But it's important for us to remember the context that they can have and that they can really keep people from wanting to come into therapy. It's one thing if I'm going to come to therapy by myself because I know what I'm going to share and what I'm not going to share. I have total control over that when I'm with the therapist. But if I'm going to come into therapy and bring my family, there's only so much control I have, right? What if another family member brings up what the family secret is? So that can be very, very stressful. Something to really try to work out with families as best you can. One of the things I always talk to families about and couples is I call it a consent, but it's really just a form that I have families sign that talks about the difference between confidentiality, privacy, and secrets. And so I explain to them when we're working as a family or we're working as a couple that, you know, that I have this ethical burden of confidentiality. You know, what says here stays here. It's all a whole bunch of secrets of, you know, it's like a vault inside my head. That's confidentiality. It's actually a legal issue. privacy, when you're working with a family, you may see some of the family members individually, and they may share something with you that doesn't really impact the family as a whole. It's kind of a private issue in the sense that it's not your place or my place to share it with other people. It's private. And private issues are okay. But secrets are kind of the next step after that. And secrets are something that if there are secrets, it holds back the therapeutic process. Privacy doesn't, but secrets certainly can. And so I try to explain those three different things, and I have a special form that I have family members go through, and they have them sign that says that they will respect the difference between confidentiality and privacy and secrets. I also share with them, particularly with the couples, that there are certain secrets that we just can't continue to work unless those secrets are going to come out. So if we're working on therapy with a couple, and individually one of the partners says to me, I had an affair, but I don't want my wife to know, that's a secret. That's a secret that holds a lot of power, and it can definitely interfere with the work that's being done. And so what I share with couples, well before anything like that could come up, is that I would never, first of all, it's not my place to share your secret with anybody else. So I'm never going to go to your wife if you come and tell me that and say, guess what, your husband had an affair. But I'm going to talk to you about how you could bring that up in the context of therapy to help the relationship move forward and take the consequences of it. And if you're not able to do that or willing to do that, then we may not be able, I may just refer you on. So I'll give it a little time, and that can be tough. So what that does is kind of preemptively allows family members to know there's certain things that they shouldn't tell me unless they're willing to share it with the whole patient, which is the family. And so then they think a little bit differently. Then what you find is sometimes people will still share with you their secrets, but it has a different context to it. It's a test maybe, or it's something that they want the wife to know, but they don't know how to tell her. So they're going to tell you, and so hopefully you tell her, all these types of things. Or they just want to get out of therapy. So they're going to tell you so that you will eventually stop seeing them. All different kind of dynamics, right? So there's other barriers when you're dealing with families, just like when we're dealing with individual people. And some of that has to do with fear. So families have fears about what will happen in therapy. And sometimes that's based on what they see on TV, which is not realistic sometimes. And sometimes what they see on TV is, I think there are some things that are getting better, but a lot of things are not really good descriptions of what happens when we're doing the type of work we do. So they have a fear of what it's going to be like. They also have fear sometimes that the family may gang up on them. The family may really bring out and recognize what bad things they've done or that they're a failure. And so that fear keeps them from being willing to participate in therapy. What I encourage people who have some of those fears is, first of all, I remind them that the therapeutic process, they have some control over. So at any time they can, I always tell people, I think I should always be kind and respectful. I also have to be direct and bring up things that are hard to talk about. I think I should always do that in a kind and respectful way. And you can always, as the client, say to me, I don't want to talk about that. Now, that doesn't mean I'm not going to bring it up again. But you always have the right to say, I'm not going there. So kind of educating people can help them get through that fear as you're building some rapport. And then even with the, and that goes for even these concerns about, what if the family's there and things come out, they gang up on me. To remind the family that part of my job there is to make sure that that doesn't happen. And to make sure that if that does happen, that it gets interrupted and that we process it so that we can learn from it. And so that can sometimes help alleviate some of the fears of the people. So in this example, we have a caller. So look at the therapist. That's me. That's how I dress when I see clients. Not really, but maybe I should. But let's say we have a caller that calls and she says she wants you to, this is the simple scenario. She calls and says, we're a really strong family, but lately, as the kids are becoming teenagers, we're having some difficulties, and we just want to sit down and really work through that. And it'll be me and my husband and our 2 kids, and I've talked with all of them, and everybody's willing to come, and we're very excited. And then you schedule your appointment, you move on. Wouldn't that be fantastic, right? Usually is not quite that simple. Now, sometimes you have a family that calls and says, we've had a loss, maybe the wife calls and says, my husband was killed in a car accident and it was very sudden. And I'd really like to come in and bring the kids so that we can all kind of process what's happened and get some support. And again, everybody's on the same page. It's heavier than that first call, but it's still relatively simple. And so that's why I made our caller here. Like, she's got all her notes and she's smiling. She's ready. She's like nice and simple. Really, it's more like this. Our caller calls and he's got 18,000 things in his mind. He's thinking about his family. He's thinking about doing other stuff. And he's trying to figure out how is he going to get everybody to come to therapy. So this caller calls as I'm in my purple outfit and says, I want to come to therapy because, we're fighting with the kids all the time. And as they've moved into being teenagers, there's difficulties. And one of them we think might be smoking weed. And I want to come, and my wife says she'll come, and 2 of our kids say they'll come, but our other child who's 13 says he's not coming, or if he's coming, he's not going to talk the whole time. That's more likely what we get when we get families that call, that there is something going on that's keeping, it's not so simple. And so we have to be kind of creative with thinking about how how we're going to deal with that. So for example, in that situation, a lot of times with families, if there are children, whether they're adults or younger, involved, a lot of times I'll ask to meet with the parent or the parents first alone, and then establish some goals from their perspective, and then either pull the family in together, or maybe even meet with everyone in the family individual if that's possible. Now, in my setting in private practice, that can take weeks. So, if we see a client, if we see one family member a week and there's 5 family members, then we're looking at 6 weeks before we can get the family in together. Depending on what the issue is, maybe that's okay. But maybe we need to get that work done quicker. So we see how that goes. One of the things we do at JP Counseling is we do some of the co-parenting for custody cases at the courthouse. And a recent family that I started working with, usually we do a session with each of the parents, and then we do the co-parenting together with the parents. And we can, once we do the individual sessions, we try to wrap everything up in 3 to 5 sessions. If it's a little more complicated, we might go more to like 7 or 10. But our goal is not to do the deep-rooted work here. We're trying to do some of the basics to get the families moving on. And if they want to do more, they certainly can. But with a family that I met with recently, I did an individual with the dad, and I did an individual with the mother. And I did not feel that the mother in particular, because of her history of trauma, I did not feel that they were ready to meet and do sessions together. So I did another session with the mother, kind of preparing her. She does have her own individual therapist, but she will not let me talk to her. So that's a little bit of a barrier, and there's some motivation there, I'm pretty sure. But I wanted to make sure that the mother was prepared enough based on her trauma experience to handle the situation. I wanted to build some rules with her and plans if things got too difficult. What can I do to support her and still help us move forward? After I had that second session with her, I thought, you know what, I think I really need to have another individual session with him, because I don't necessarily know that he is the cause of her trauma, but her perception is that he is. And so he has somehow, his dynamic has contributed to her trauma. And so I did have another session with him individually to kind of prepare him for what's the appropriate way to handle things, what's the appropriate way to talk, you know, that I may cut him off if I feel like, you know, he's getting too loud, you know, just out of respect for the therapeutic process. And then also asking him, like, what can I do to support you in this? Because of course he thinks that the mother of his kids is crazy and is, you know, whatever. So how could I support him? Then this is how complicated it can get with families sometimes. They have 3 boys, and I wanted to meet with the boys because what both of the parents were saying was very different about what the boys were experiencing. And so I wanted to really meet with those boys and find out for myself what they were experiencing, so that they could be part of the process. And so I met with them with neither parent, I met with just the 3 boys. And then finally, last week was able to meet with the 2 parents together and start the co-parenting. And it went kind of exactly how I thought it would. But that is more, I know that was a long, drawn out story, but that is more realistic about what it's like sometimes when we work with families that are coming into therapy. It's not usually, hey, we're all willing and ready. I mean, those are great. I love those. Although I'm always waiting for the other shoe to drop. Like I'm waiting for like session number 3 for someone to say, you know, what about our, you know, grandmother we keep locked up in the attic? Are we ever going to talk about that? Or something crazy. But that happens sometimes. Sometimes it doesn't. But most likely we're dealing with much more complicated cases like these. Establishing their therapeutic alliance is just as important with family as it is with individuals. And this can be complicated because because you have to do it with multiple people at the same time. Now, ultimately, everybody in the family is working on the same goal, but sometimes different family members are working on different smaller goals to get to the bigger goal. So the example here I gave is the counselor might say to the mother, therapy for her can help her son stop using drugs. You know, that can be the goal. The mother says she wants to come to therapy because she wants her son to stop using. She can say to the son, therapy can help get your mother off your back and help keep her from nagging you. Say to the father, therapy can help stop him being called in constantly to play the bad guy. And so in each case, there's a different goal, but really the ultimate goal is kind of the same. So helping family members establish those different goals and helping them feel that you're invested in each one of them certainly helps with that therapeutic alliance. So to keep families engaged, you want to when someone calls you and is initiating therapy or connects with you to initiate therapy, you want to talk about what some of the family dynamics are. You want to talk about what any of the barriers might be, and then you want to start to explore what some of those things might be. That's how you keep people coming back. Once you get them there, that's sometimes that's an easier part. So I like this concept of complementarity, which is understanding how the family pieces fit together to create some resistance. For a family to work as a unit, even if they don't work, even if they're an unhealthy type of family, behaviors of each family member must fit in with the behaviors of other family members, and that makes them complementary actions and reactions. So for example, in a case of resistance, let's say the husband doesn't want to come to treatment. So that's the action. He doesn't want to go to treatment. The wife excuses him for not going to treatment. That's a complementary action. Similarly, if a caller tells the counselor that whenever she says anything to her husband about counseling, that's the action. He becomes angry. That's the complementary reaction. Then the counselor needs to know exactly what the wife's contribution is in this process. So for example, how is she asking him to go to therapy, and why is she asking him to go to therapy? Is that not that it's her fault if he's being angry, but is the way she's delivering the message the most effective? So if you think about those family roles we looked at earlier with all those different circles and the mascot and the hero and the chief enabler, they all fit in with each other. That's why we can map out those types of families easily, because they fit. Everything kind of fits together. So reasons family gets stuck, same reasons why individual gets stuck. They have denial, minimization, avoidance, blaming, and then sometimes joining in with things that are not so helpful. They take over responsibilities that are not theirs. They help to resolve legal problems that are not theirs. Provide financial support when maybe it's no longer appropriate based on age or all sorts of other factors. And sometimes they promise unrealistic rewards for abstinence. So these are things that families do when we're dealing with mental health and substance use issues and co-occurring. This is how they get sick, and some of the behaviors we see out of them. Other things is they threaten to kick people out of the house and they don't follow through with boundaries set. You know, I've said that, I've shared with you sometimes when my son was, you know, really in his worst behaviors. You know, it was like, I don't know what else to do. Like, I've punished you so much. I think the next thing, all that's left is I'll have to kill you. It's it. There's nothing else left. So, and I'm not going to kill him, so I should not threaten to kill him. But learning to not set a boundary if you're not able to follow through with it is important. Sometimes families provoke arguments and nag, and then they avoid getting help from self. So the person with the substance use or the mental health issue becomes the focus of the family, because then I don't have to get better because they're sicker than I am. That type of mentality. So when family members are dealing with someone who's dealing with co-occurring disorders, one of the things that they can do to help that person is to encourage the person to follow through with all of their treatment recommendations, and to help them in any way that they can. You know, I often will tell family members, anything that you can do, you want to make sure, you know, if you're not sure, should I do this or should I not do this? Ask yourself this question: does this behavior support my loved one's recovery? And if it does, then that's okay. If it's something else, then you got to think it through. So, you know, for example, if someone who's dealing with co-occurring disorders comes to me and knows that I recently got opiates because I had tooth surgery, and they say, you know, that they're having some back pain, could they have a few of those Percocets? Well, does that support their recovery? Probably not. So that's not something to follow through with. So to think about those types of things. And there's so many resources available, you know, through Beaver County Behavioral Health and other providers in our county and in our area, that there are lots of resources for people. And so to be able to encourage people to support people utilizing those. Help people build on coping skills that they have, and recognize that there are going to be bumps in the road. You know, that puzzle, at some point, a puzzle piece or multiple puzzle pieces are going to move, and you want to be prepared for that. So prepare for, not dwell on, but prepare for unexpected losses with relationships, with jobs, with where you're living. People get sick, people have personal problems, people get angry. And just trying to help people develop their recovery program so that it supports being able to get through these types of things. Developing coping skills and being there to listen, talk, and help people process stressful situations, being part of their we, helping solve practical problems. So if they're having difficulty figuring out how to get to work, you know, brainstorming with them ways, not necessarily taking them to work, but brainstorming with them ways that they could get there, and reminding them of the coping strategies they have, and that dealing with cravings and dealing with symptoms is normal. That's going to happen, and so we just want them to be prepared for it. So when we're doing family therapy, some of the things we want to do is work on communication skills that can help. You know, communication skills can go a long way to making better relationships. We want to help families be more flexible and resourceful when they have difficulties. We want to help families be able to share in whatever way feels appropriate to them feelings of care and love and pride. And then we want to help families understand and enjoy how to spend positive time together and enjoy the good things about family, right? Some of the specific things they can do, family members can do, is they can go to meetings. This is a little tougher right now because a lot of 12-step meetings, for example, are virtual or not happening, but there are still some that are open. But going meeting shopping with a loved one, so saying, you know, I'll go to a couple of meetings with you till you find one that you think you like. It can be hard for people to walk into a meeting for the first time when they've never been to one before, or they've never been to that one. And so sometimes having another person with you can take that pressure off. So being willing to do that if it's an open meeting, adjusting the family schedule to support the meeting. So if my loved one says, well, I really like this meeting on Thursday nights at 6, but we always have dinner Thursday nights at 6. Well, that's okay. We can have dinner Thursday nights at 7:30 or 8, or we can have dinner and when you get home, we'll have a plate ready for you. You know, so being able to be flexible with those types of things to support meetings and treatment and those types of things, and really learning about the philosophy of what recovery means. Not taking over the recovery for the loved one, but learning what how they see it, so that you can kind of speak that language, and you can, and it shows that you care, you know, that you like. You know, we all know that we do things with loved ones that we don't like to do, right? Like I watch Gold Rush every Friday night, and that is not a show that I'm so keen on, but I watch it because the man that I love loves that show. And so I watch Gold Rush with him, and then he appeases me and watches Love After Lockup. And so, you know, we do those things. That's just a way that we show people that we care. So showing an interest in what someone's doing in recovery and learning about their recovery is like that. Help people develop, make sure they have a sober peer network, reconnecting with sober friends, and helping them develop new sober friends. This can be difficult because sometimes in the world of substance use, the families are really clueless about who was using and who wasn't using. So sometimes there are people that they absolutely know, but a lot of times they're like, I had no idea. I thought I didn't know you were using with that person. So I think this is a place to help them tread lightly, but to support the person thinking about who could be helpful for their recovery and who would. And then knowing the early signs of relapse, and for the family to even develop kind of what their plans are going to be if a relapse takes place. So knowing what relapse signs are and knowing them earlier, because the earlier we catch relapse, whether it's mental health or substance use, then the better that usually is, the outcome usually is. And, you know, I tell people all the time, sometimes we don't notice things in ourselves. We need someone else outside of ourselves to say, hey, I noticed this about you. You know, I noticed you're coming to work late all the time now, and you never used to do that. Maybe that means something. You know, take a look at it, and to say those things, of course, with love and respect as best you can, but really to point out to them where there might be some early warning signs. And the family really should develop a good plan in advance of what they're going to do if there is a relapse. So not to wait until a relapse happens and then say, well, now you have to go to treatment or else, but to let the person know in advance, you know, we're not anticipating, we're not saying you're going to relapse, but let's just be realistic. You know, there's a possibility. And so we want to let you know, if you relapse, you know, you're not going to be able to live here unless you go right back to treatment. And again, don't say things that you're not willing to follow through with. But I think it's important that we look at mental health the same way we look at physical health in this context. If my kid has a peanut allergy, and he has a bad reaction to peanuts, then I don't just say, well, let's just hope that doesn't happen again. You know, I become prepared, you know, and I have an EpiPen, and I have a plan. If this happens, then this is what's going to happen. And that's what we need to do with mental health as well. If there's a relapse, I know relapse looks different than allergy, you know, to peanuts, but we need to look at them in the same context. If this happens, here's what we're going to do to support you, and here's the choices you have, and here's what's going to happen. And to do that in advance is really helpful. For the family to take a look at their own enabling behaviors, and that can be really tough for family members, because people enable mostly out of love or out of safety. And so those can be tough things to try to change a behavior with. To remind family that addiction and mental health is not personal. You know, they are diseases of the brain, and we're all susceptible to them. I mean, there may be some multi-generational influence there, but it could happen to any of us. And so it's not these are not value diseases. These are not moral issues. These are disorders of the brain, and we're not responsible for them, although we do contribute. And then even if your loved one, to help family members try to understand, this can be very difficult, that even if their loved one does not get help for their disorder, that it is important that the family still gets help. You know, so for this family whose son recently completed a suicide, you know, they understood that for many years, that there was only so much their son, as he became an adult, was willing to do or able to do in some ways, but that they still needed some healing for themselves. And I think that's a really, really beautiful thing when people can recognize that. Detachment, so recognizing what you can and cannot do. So again, going back to that serenity prayer, what's in my control, what's not in my control. Stop enabling, create boundaries that protect safety and sanity, and find ways, you know, sometimes it's hard for families to find joy because they're so inundated with what's happening with a family member or a loved one that has a co-occurring disorder. But to help them kind of compartmentalize that there can be parts of your life that are still joyful, even though there's this really, really heavy part. So this was a quote that I found that I thought really captured detachment. It says, "I can't control you. I can only control me. If I am hurt, then I have to take care of me. I have to get my center back so I can function again. I heal through connections and balance. Health is here, and you are welcome to join me. I take responsibility for myself, and I bring the benefits of my healthy relationship, my healthy lifestyle back into my relationships. I share myself with other healthy people. You take care of you. I take care of me. We support each other." And if we can all accomplish that, we have a way better world, right? And then some of the communication skills, you know, I always think of this book I read years ago called Raising a Family. And the one thing that has stuck with me all this time is it said to ask yourself this question: what does this family need now, including me? Sometimes what we do is we say, what does this family need now? ? And that's where we end the question. And we think about what everyone else in the family needs. But to remember that I'm part of this family too. So what does the family need? That includes me. That question has always stuck with me, and I teach that to a lot of families. Using I statements, so it's not always about what you did, it's about how I feel about it or how I am interpreting it. And then I hate that we have to do this, but I think it's important to just remind people that, you know, name calling, yelling, threatening, those things are never healthy. They may have a meaning to them. So I don't want to disregard them by any means, but just to set some context and rules for what's respectful and what's not. This is another one of the handouts that you're going to get when Jen sends out the handouts, and you'll get a blank one like this, but this is a helpful exercise to do with families. You know, the arrow coming in the top is the first thing that comes into my mind. And then I use my judgment to decide if my words need filtering. So what is my intention? Am I saying this to hurt someone? I have a choice. Is this something that needs to be said? I have some compassion. Can I try to understand the other person's feelings? Empathy. Can I try to see through the other person's point of view? And then some other questions to ask is, will this embarrass the other person? Is there a better way time, or place to say it? Did I listen properly? Did I give the other person a chance to explain or apologize? And are my words respectful? So how would I feel if someone said this to me? And so what you're going to get is a blank copy of this, which you can really use for patients to say, you know, to kind of answer all these questions and come out with ideas about whether they should or should not say what they're thinking about saying. And then a couple quick points on relapse prevention that I don't think we're going to get to, but I did think this was funny when this lady is in bed with this guy and says, guess what? I found a new sponsor. And she's probably talking about him. That's not really what a sponsor is supposed to be, right? But for the family relapse plan, set expectations that are realistic, that are natural, and that are set in advance. And then just remember that the family is the first essential cell of human society. Now, that was said by Pope John 13th, I think, or 23rd, because X's are 10, right? So Pope John the 23rd. I think it's a really important statement, though, that the family is the first essential cell of human society. So with that, if you have, I'm going to take my screen away here. If you have any questions,